Thank you for tuning into NorthPoint, Making Health Happen. My name is Biftu, and I'm your host. This is a new series brought to you by NorthPoint Health and Wellness Center. We want to connect with you about topics in health and wellness that impact our community. We will feature guests from our team and around the community to talk about the health and wellness issues most important to North Minneapolis. Together with our guests, our community, and you, our listeners, we are partnering to create a healthier community. Today, we are joined once again by Dr. Kevin Gilliam. Dr. Gilliam is a board-certified physician in family medicine and obesity medicine. He has been a member of the NorthPoint family since 2009 and serves as our associate medical director. He was named MSP Magazine's Top Doctor Rising Star in 2017 and was recently featured in the Star Tribune's Our Best Shot series promoting the COVID-19 vaccine. So, welcome to Dr. Gilliam. Thank you for joining us. Today we are talking about Men's Health Month, and we have a few questions we'd love for you to answer.
Well, great. Thanks for inviting me back again.
Absolutely. Thanks for coming back. So we're talking about Men's Health Month. Tell us, why is raising awareness about men's health important?
Well, I think it's important for a number of reasons. Often in conversation with men and with, I guess, all people really, is the biggest reason to engage in healthcare and health and improving our health is really to allow us not just longevity of life, but to improve the quality of that life as we add days and weeks on to the end of our lives. So when we're in the prime of our lives and we're young and feel vigorous and have energy, that is the time to invest into our health and well-being, so that as we get older, that we can still have some of that youthful vitality, that we can kind of maintain and continue to do the things that we desire to do, the things we enjoy to do, as we get into, as people reference, kind of their sunset years. It's sometimes people say that, and it's a bit tongue-in-cheek, that youth is wasted on the young, because you begin to appreciate things differently as you age. And so really encouraging men, particularly young men, to value their health and their wellness, because it's when you get older that those decisions you made when you were young begin to impact you a little bit differently. So it's important for all people, but particularly men, since we're talking about them, or us, me, to value health and to encourage wellness.
Absolutely. So the statistic is that on average, men live about 5 years less than women, at least in the United States. Why do you think that is?
It's another one of those things that has a lot of different factors that go into it. Men, it's a cliche, but it's a fact, access care less often than women. And therefore, once you get out of childhood, when your parents take you to the doctor often to get your immunizations, many men disappear from care for decades until something happens. It's not uncommon that I'll, meet a man in care who is in his 40s or 50s and hasn't been to a doctor since he was a teenager. Because unless you're getting routine immunizations, or something happens where you break a bone, or many men present if there's a sexual health concern, but a lot of times men have no other reason to go to the doctor if their body does not present them with a symptom of pain or something else. But women, on the other hand, because there's childbearing, and then the child rearing, and so on, if the and they're more often the ones who are going back and forth to clinics or to doctors for different reasons. Um, they tend to access care more often, and therefore are given the impetus to be more proactive about their care and their screenings. And so that's one of kind of many factors. And the general culture of men is one of a little more of kind of less risk averse, I'll say. So the less healthy practices, and so that would bring down the kind of the average length of life for men, because younger men tend to engage in kind of more risky health behavior that would potentially lead to a shorter life in the end.
Okay. And so I was going to ask, why are men less likely than women to seek health care? But I think you covered that. So let's talk about seeking mental health care and why that's stigmatized. Can you talk about that?
Yeah, I mean, I think it's becoming less stigmatized in the recent past or recent years, as culturally, which I think is a good thing. The culture is moving to embrace kind of mental well-being as well as physical well-being. I think maybe a decade or so ago, people really started getting into kind of physical wellness and kind of eating better. It's been more of kind of a cultural push. And in these last few years, I feel there's been more of a kind of a mindfulness push to things. And, mindfulness practices have been around for centuries. But I think it's been renewed here recently. And then, realizing that, there's a large percentage of men who report that they experience depression or have experienced depression in their lifetime. And that those who report are likely a small portion of the grand total, because the human experience is one kind of fraught with challenges to our mental health, and culturally, as men, we are taught to just shoulder, to kind of grit and bear things, and not to kind of show any kind of imperfections in armor or kinks in the armor, to put a strong face, even though there may be some damage to your kind of mental well-being. Just kind of, you're supposed to just take it. But it's now evolving, and people are realizing that it is okay to reveal some of these vulnerabilities, in that it is not a show of weakness, but of strength. That if you are able to kind of verbalize what your emotions are, and what you're actually feeling, that will allow you to get to a place of healing, because we do know that those embodied stressors that lead to some of these chronic mental health things, so chronic depression, chronic anxiety, those kind of things, lead to chronic medical conditions. So your physical wellness suffers when your mental wellness is not taken care of adequately. So if we as children suffer through traumas, those traumas then lead, that are not addressed, can lead to some of these chronic mental health concerns, which then can lead to chronic medical concerns. And so there's a direct line of connection between a childhood that may have been fraught with trauma and and stressors to an adult who now deals with chronic medical conditions, and then does not live as long as one would expect, um, because of things that may have happened when they were a child, and those things not being addressed, um,
Right.
uh, because of the way that our society has told us that men um, should essentially ignore some of those
Mhm.
things, um, because it's a show of weakness if they do um, reveal that they, feel sad or feel stressed or feel anxious. Um, so I think that is why it's really important to really encourage our men, people broadly as well, um, that if they are to talk about what they're feeling, how they're feeling, and
Mhm.
to grow in comfort in doing that. Um, and because it's really the only way that we can kind of help people um, to improve the quality of their lives as well. If we are able to kind of open up in conversation um, about what it means to be a whole person,
Mhm.
um, and to kind of really lean into each other's humanity.
Absolutely. Thank you. Um, let's talk about medical issues now. So, can you name some common medical issues that are specifically impacting men today?
Yeah, it's interesting. Heart disease,
Hmm.
cancer, diabetes are kind of the big things.
Hmm.
Um, and for men specifically, the one of the first symptoms of kind of heart disease, and like hypertension.
Hmm.
Hypertension is what we often refer to as a silent killer, because you don't know
Hmm.
that you have it necessarily,
Right.
um, and because your blood pressure just goes up quietly. But many men will present with heart disease. Their first symptom often is erectile dysfunction,
Hmm.
um, because the um, that whole process is mediated through blood flow,
Right.
um, and so the blood vessels there are the same as the blood vessels around the heart and then other parts of the
Hmm.
body, um, and so oftentimes that'll be the first presenting symptom.
Hmm.
So you then go looking for um, kind of other risks that people may have.
Hmm.
Um, so we often, you may come in with one thing, but then we then look around to see, well, okay, well, why is this happening? So there may be the sugars may be elevated. So that's,
Hmm.
pre-diabetes or diabetes. The blood pressure may be elevated. Um,
Hmm.
and there may be, elevated cholesterol with kind of heart disease and things similar to that, which have led to the complaint that they came
Hmm.
in for. But then it
Hmm.
reveals these other things that are developed kind of
Sure.
behind the scenes,
Right.
um, without their awareness.
Okay. Thank you. And then, can you tell us about what common recommendations you would give to men to improve their health?
Yeah, there are a few big things. So eating,
Hmm.
so making sure that kind of we're eating um, as quality food products as we can. So avoiding as best we can processed foods.
Hmm.
Um, and so always encourage people to when you go to the grocery store, kind of shop on the edges of the grocery store, because that's generally where you'll find your vegetables, your meats, your breads and things. But when you go down the aisles, when you find your processed foods, so your boxed, bagged, canned foods. And if you have to have those things, try to limit them if you can.
Hmm.
Um, be as active or physically active as possible. Many have very kind of physical work, um, uh, but then outside of that work, our lives sometimes can be sedentary. So we do a lot of sitting, watching
Hmm.
TV, and that. So
Hmm.
being as active as you can. Um, and then getting plenty of sleep. Um, so oftentimes we say, well, there's this common refrain, I'll sleep when I die. Um,
Mhm.
but you need sleep to live. Um, and without it, you usher your death in much sooner. Um, and, so getting adequate amounts of sleep, you know, studies and experts reveal that the average person needs about 7 to 8 hours of sleep a night. And so if people tell you all I need is 4 or 5 hours, they're not telling you the truth. Um, and so getting plenty of sleep and rest um, will not only make your body feel better, it will help your mind to feel better. And because one of the many symptoms of depression and anxiety is disturbance in sleep. So if we are able to sleep better, or if there are issues with sleep that we don't know why, that kind of leads us down a path to discover perhaps this is related to some unrealized kind of mental health concern, or some physical health concern. So eating better, physical activity, and getting good sleep um, are kind of the three big things that I try to get across to people, um, particularly men who will sacrifice um, all three of those things in an effort to um, fulfill the responsibilities that have been placed upon them.
Right. Okay. Thank you. And then lastly, let's just talk about NorthPoint and what men seeking healthcare can find at NorthPoint.
Yeah, I mean they would be able to find all the things that they would need, at least in my opinion. The you know the basics of healthcare is really just forming a relationship. So getting having a relationship with a clinician that cares about your well-being and your health and its longevity. Making sure that all the things that are necessary to be checked are checked. So looking at your blood pressure, checking your weight. If there's a family history of issues, checking things. So if we need to check your sugar to see because mom or dad or grandparents had diabetes. So checking those things, cholesterol. When you get to a certain age, so 45, making sure your prostate screening begins, making sure your colon cancer screening begins. Um, so doing all the things that are necessary and that kind of modern medicine has to kind of aid in prevention of kind of chronic disease um, and making sure that people are that men are healthy and are able to do the things they want to and not have their bodies be a limitation on that. Um, so yeah, we offer the full gamut of services, so medical services, mental health services, dental services, and so whatever the issue may be, we can help to address it and kind of help our men to be kind of healthy and well.
Absolutely. Thank you. Well, that is everything that I had to ask you. So thank you, Dr. Gilliam, for answering our questions for Men's Health Month. Um, yeah, thank you.
All right. Thank you.
Today's guest is Isiah Jones. Isiah has a passion for youth development and development with over 10 years of experience making impact on young people through program management. Before joining NorthPoint in 2020 as the youth services supervisor, Isiah spent the last decade as director of Camp Sunrise, a program of youth care working with Minneapolis and St. Paul youth ages 13 to 18. So, welcome, Isiah Jones. Thank you for joining us to talk about Men's Health Month. So, Isiah, you are at NorthPoint working with two of our programs involving young men, young boys. And we want to ask you about other factors that impact their health. So, from your perspective, what do you see impacting their health?
Thanks again for having me. Some of the, or two of the biggest things that we see that impact men and young boys' health is institutional racism um, and stress. Discrimination is associated with depressive symptoms, and depression is one of the leading causes of disability, leading to lost years of healthy life. So, the experiences that young men and boys go through on a daily basis causes stress on themselves, which then leads to adverse health effects. People that experience chronic stress often use unhealthy ways to cope with that stress. So unhealthy behaviors, such as smoking, alcohol abuse, unhealthy eating habits, all to cope with the increased stress that we face, lead to adverse health effects. Um, Institutional racism as well, in terms of um, segregated communities, less access to quality education, restricted employment opportunities. All of this contributes to unhealthy stress buildup. And also, the traditional gender roles that men are kind of expected to follow in society, so being the breadwinner, being the strong male
Right.
figure, that balanced against the stress that they face, and then also the lack of opportunities because of institutional racism, that has a compounding effect on their mental well-being, their health. And so racism, the two biggest things, like I said, the stress that it uh, puts on us, and then also um, the depression that is associated with discrimination.
Can you tell us from your experience something that maybe the general public doesn't know that isn't very obvious? What do you want us to know about men's health? Because it's a topic really not talked about specifically. When we talk about health, we don't really focus on men.
The adverse effects on our health are not set in stone. They can be
Mhm.
addressed, and especially at an early age, young men and young boys can learn healthy ways of coping with these stresses that they encounter on a daily basis. They can learn healthy eating habits. They can learn healthy physical activities that help them alleviate some of the stress that they deal with on a daily basis. And um, knowing about the aspects of institutional racism that affect us on a daily basis empowers us to then take action against those, empowers us um, to seek out health resources that are important to our overall well-being. So I think what I'd want people to know and to learn about it is that although we do face um, a higher mortality rate than our white counterparts, and we experience higher levels of discrimination than women. These things are not unchangeable. These things, learning about these things through programs and services at NorthPoint empowers our young men and boys to improve their health outcomes long term. The NIA program, it's a really wonderful program for young men and boys in North Minneapolis and surrounding communities who've had some involvement with the justice system. It's a community based alternative to out of home placements, and it's structured with three key components. One-to-one case management, where young people are able to have a case manager that's working with them to set and achieve goals. There's weekly empowerment groups, um, and there's independent living skills workshops as well. Weekly empowerment groups give young men and boys an opportunity to come together in a group setting and learn about all sorts of topics that impact them on a daily basis. Community violence, how to grieve, how to build quality interpersonal relationships, are all aspects of the empowerment groups that happen as part of the NIA program. And then the independent living skills workshops provide information about housing, about healthcare, how to access these programs at North Point. And then that one-to-one case management is integral to the program, helping these young men set and achieve attainable goals throughout their time in the program. The program serves 12 to 24-year-olds in and around North Minneapolis, like I said. Curriculum was developed from evidence-based trauma and recovery model that's been adapted for men, so MTREM. Yeah, it's a program developed for young boys and men of color, and being operated by NorthPoint. These young men and boys have really easy access to the NorthPoint Clinic and all sorts of health services.
Yeah, thank you, Isiah Jones of NorthPoint, for your time and telling us about your work and what you do and how it's important to men's health. Thank you.
Thank you so much for having me.
Absolutely. Thank you for listening to NorthPoint, Making Health Happen. We want you to know that we are here to partner with you, that you can dream, and that you can reach your dream. Please subscribe to our YouTube channel to watch our show in video format. And if you like what you hear, share with a friend. To read more about NorthPoint or find out more information about the COVID-19 vaccine, check us out on the web at northpointhealth.org.
When you walk through the doors, we're here with open arms. We know the times get hard.